said early on when we started, of course, we saw an increase in the number of TB cases. That is in 2021. And of course, Dr. Irungu will just throw this to you. Why? Because in 2020, it's like we were doing very well, you know, the numbers dipped. But then in 2021, we started, you know, noticing a bit of increase. Is it COVID, you know, interference that brought about?
Yeah, so COVID has not been very nice to the TB community.
True.
Sure.
And I'm sure the patients out there can speak for themselves. In 2019, we had around 86,000 TB cases that we diagnosed and put on treatment with susceptible TB. However, when COVID came in 2020, with all the disruptions,
yes.
I don't need to go with that, our numbers dipped to 72,000. So that means from 86 to 72, we missed about 16,000. Is it?
Yeah.
14 or 16? Yeah, 14. However, in 2021, some interim numbers, which are not yet final, shows that we could have a slight increase because the system has responded to the COVID-19 pandemic. So what happened is that when COVID came, the health disruption had a lot of implications in the TB control. And remember, TB is a disease that we have had for
a very long time.
a very long, million of years,
Very
depending on
long
statistics.
time. Yes.
Before Jesus, TB was there. TB is not going away. But there's a lot of effort and money that has gone into TB control in this country and globally generally. And TB, as Dr. Lorraine mentioned, is one of the diseases that plagues this country. We are one of the 30 high burden countries. It's not something I feel proud talking about.
No.
Out of the 200 and over 200, Kenya is one of the high TB burden. So TB, HIV, and we're a priority country for drug-resistant tuberculosis. So what happened in 2020, the patients who are on treatment, who are being followed up in our TB clinics and chest clinics and the other departments are being followed up, had to interrupt treatment at some point. And the problem with interrupting treatment, you create more problems.
True.
You have more complications, you can develop drug-resistant tuberculosis, you can develop more germs so that you are able to infect more other individuals, which is a big problem. And you infect another individual, that's another problem. As you can remember, they infect other 15 people, and the other another 15. So over time, it becomes a big problem. There are those individuals who are on treatment. We are following them up nicely. When COVID came, there were lockdowns. Everyone was scared of hospitals. You could not go back to the hospital. That's a big problem. And these individuals whom we did not diagnose, again, are a big problem because they infect you and me. Me and the other Kenyans watching this station right now. So that's a big problem for us because that means we went back miles. Actually, I think we're back to around 2015, pre-2015 era. So all the efforts that we did in those number of years it probably went to waste, if I was to call it that way. And then it is projected that in the next 4 or 5 years, more individuals are going to die from tuberculosis, which is very unfortunate.
Unfortunate,
So today, as we speak, yesterday, 12 people died in Kenya from TB.
From TB.
The day before that, 12. Today, there'll be another 12, and tomorrow there'll be another 12. That's a lot of
lives lost.
Lives lost. In matatu mzima. That's a whole mat. Just, you know, we report road traffic accidents every other day when they happen. 1 or 2 people, but it is an entire matatu. And that's going to increase. It probably be 1.5 matatus or 2, depending on what we do now. And we are working on how we control
we need
that.
to prevent the same
because TB is a disease that is preventable
and treatable.
And treatable, and it's cure. You can cure tuberculosis without any issues. We don't have. I like that these guys are here.
Exactly. I was about to say that.
And I'm glad they are here.
Yes.
But then, unfortunately, about 10% of the guys they got infected together or developed the disease together are not there anymore. That's the unfortunate bit of tuberculosis. Which is.
And we can't. It's just sad. We can't really have more lives lost again to TB, which, like you said, is preventable, treatable, and curable. You know, at the same time. But let's go back to Joshua. So Joshua, November 2017 is when you began feeling, you know, sick, you know, here and there. But until July 2018. That is when you were diagnosed with TB.
Sure.
That is like a lot of months What
Yeah,
was
yeah, sure.
happening? Did the disease, you know, like become worse? What was happening during this month?
Those months, it wasn't a quite like enjoyable months.
Yeah.
Because I was trying to struggle and fighting, trying to know what's happening. Like one thing, like I didn't understand is that how comes why is it that I'm eating, then my weight
You're
is
losing
still
weight.
going down,
Yeah.
going down. I remember there's a trouser that I used to put on. Ilikuwa like mshipi nilikuwa nafunga nyuma.
Okay.
Yeah. Then right now it can't fit me anymore. Smaller.
Became like a negotiation, like
Yeah.
saying.
It was negotiable. So like what made me like to go through that time, I was still believing the over-counter drugs.
Okay. Does this, and again, of course, Dr. Lorraine will answer this, does this then make the situation worse? Because from what Joshua and Elizabeth are saying is, I just went, got over-the-counter medication, you know, took them, sometimes helped, sometimes did not help,
Yeah.
but, you know, so does this then contribute to a case of drug resistance TB? But before that, so finally, you were diagnosed with tuberculosis, right?
Yeah.
What was your reaction? What were your emotions once the doctor tells you, listen, you have TB? Because there's a lot of cases of stigma and misreporting and misconceptions surrounding TB, that sometimes when someone tells you you have TB, of course, you know, there's a certain way that you feel. Yeah, but for you, how did you feel when the doctor says, yeah, tested positive?
Thank you. The feeling that I had, what came in my mind is that first, I can't say I was excited, but I was a little bit happy. Because
that finally you know what is going on.
Because I was eager to know what's happening to me. But when the results were out and I was told, you have TB, so when we will start your medication right now, today, but the moment you start taking medication, you'll be cured completely. Completely. As long as you're going to take medication in the right way at the right time and don't miss a single day.
Yeah.
I told the madam, I'm ready.
Did you know about TB in terms of how long you would need to be on medication, what you would need to do? Like, did you know about TB before this?
You
had the information?
Yeah, I had a little information. And my dad had also advised me to go for the test for tuberculosis, specifically tuberculosis.
Why?
Because he was wondering at night, I'm coughing, severe coughing. Then when I wake up, you find that my beddings, they're so wet. Even when the sweat is dry, you could find the bedding are hard or rough. Yeah.
Okay.
Yeah,
All
so
right.
like my dad had informed me to go and just go do this and this and this, and don't run away. Yeah, this is a journey, this is a fight that you have to win. Yeah.
Okay. And Elizabeth, did you have like the same reaction? Because you were told to go for an X-ray. Took a bit of time. Eventually, you were like, you know what, fine, let's just go, right? You went, and of course, you also tested positive for the same, right? For tuberculosis. How was it for you receiving the news?
Thanks so much again, Winnie. When I received the news, I didn't get very much shocked. I think because I didn't have a lot of information of what it meant to be infected with TB. All I knew was that there was going to be a long duration, that is 6 months
Of treatment.
of taking medication. Apart from that, I didn't know much. I didn't know how serious it was, how bad it can get with the infection.
Yeah.
I don't know, so I took it lightly.
Yeah.
And my main interest at that time was, can I start medication at least because of the complication I had breathing in and out. So I just wanted to start with the medication. But yeah, the reception of the news didn't really affect me much. Yeah.
Okay. All right. Because there's one person I was talking to, and she was saying it did not go well with her, you know, given the stigma and of course what she had had before about tuberculosis. So she was like, it was the worst day of my life, you know, recounting how she was told that you have TB. All right. So you began medication immediately.
Yeah.
Were you able to adhere for the 6 months, or was it like, got to a point where you started feeling a little bit better and you decided, you know what, see, I can maybe pause, maybe I can stop. How was the journey for you for the entire 6 months?
The journey was not easy.
Yeah.
Taking continuous medication is not an easy thing.
It's not, yeah.
Yeah, it took a lot of, encouraging myself